Hello, hello, good evening. My name is Persia Nicole. You guys can check me out on 92Q, 10 a.m. to 3 p.m. Monday through Friday. So excited to be here today with my friend Steven from the Healthcare Access Maryland, representing the Maryland Health Connection. Hey, Steven, how are you?
Hi, Persia. Good. How are you?
I'm fantastic. I'm excited because, of course, open enrollment is here. Big thing is about to happen. Tell us a little bit first about yourself and what exactly you do.
Sure. I'm a healthcare navigator working with Healthcare Access Maryland. Access Maryland is a nonprofit headquartered in Baltimore City with a mission to make Maryland healthier by connecting residents to insurance and care, educating the community about healthier living, and advocating for a more equitable healthcare system.
Because that's what we all want, Stephen, right? Okay. So as you can see, Stephen is a perfect person to get tons of questions answered. When it comes to enrollment, and we're going to get it done today, we're talking about affordable health coverage for Marylanders. Now is the time to sign up if you have not already to be covered in 2023. Do not wait till last minute because I've had my personal times where I'm like, oh my God, like, oh no. And they're like, today is the day. So let's get it all done right now. Let's talk about Maryland Health Connection and exactly how it works.
Sure. Maryland Health Connection is the state's health insurance marketplace. So, it's your one stop shop to browse and compare health plans, to find savings, and to get covered. We all know that accidents happen, and you never know when you might need emergency care or to visit a doctor or a specialist. But with health insurance, you know you're covered for any of those unexpected events that happen. So you can actually visit marylandhealthconnection.gov to compare the health plans side by side and to get savings so that your monthly premium is lower. You can also download the mobile app, and that is Enroll MHC. And you can also enroll right from the app.
And it's really, really easy too. And I'm happy you're talking about the apps as well, because right now we're so digital when it comes to our phones. Like you don't have to say, oh, let me log into a computer. Like the app is literally on your phone, just like your Instagram is and your Facebook and stuff like that. So it's super easy to navigate.
It's all there right in the palm of your hands.
Yeah, and as Stephen and I are having this conversation today about enrollment, you can ask any questions that you might have. You can just type it in, and we're going to pop it up on the screen and get Stephen's answer. How can people enroll? I mean, I guess that's probably one of the biggest questions that people want to know, right?
Yeah, definitely. Right now is open enrollment. So, open enrollment runs from November 1st and it's going through January 15th, 2023. So, you can sign up now for health plans to begin 2023. If you're just curious and you want to compare health plans, you can use the Get an Estimate tool on the website, marylandhealthconnection.gov. And you can see what plans are available and how much you can save. So you can see what savings you might qualify for. And it's just an estimate, so you don't need to plug in too much information.
Mhm.
And then if you would like to get covered, you can go ahead and apply immediately. And if you want your coverage to start right at the beginning of the new year, so January 1st, you want to make sure you enroll by December 31st. If you enroll in January, your coverage will start February 1st, 2023.
So the sooner the better. Do it like ASAP so you can get up in there, right?
Yeah. Oh, yeah.
Let's talk
And
about applying for Medicaid as well. Is that any time of the year or what?
yeah, so Medicaid has a rolling deadline, so you can kind of apply for it like on a monthly basis. It just depends on your income and your household size and things like that. So it's a rolling deadline. So I would say even if you're outside of open enrollment, if you don't know you qualify, it's still good to just apply because you might still qualify for Medicaid.
Okay, now Stephen, I don't know if you were like this, but when I first got off my mom's insurance, I was lost. I didn't know what I should do, what I should be putting on there, and what I needed or anything. What kind of help can we get to navigate through all of this? Because a lot of people need it. I know I definitely did.
Oh, yeah. We are hosting an event. Healthcare Access Maryland is hosting an in-person enrollment event.
Okay,
It'll be on Saturday, December 10th from 9 a.m. to 1 p.m. It will be at the Doubletree in Pikesville, which
nice.
is 1726 Ricerstown Road in Pikesville. And the event is part of a series of statewide enrollment events organized around the theme that set goal, get enrolled. And also throughout open enrollment, which ends January 15th, clients can access most up-to-date information about Healthcare Access Maryland, our in-person local support by calling our call center. And that phone number is 410-500-4710. And then folks also have the option to schedule video or phone appointments with us so they don't have to leave their home. And that would be with a navigator like myself. And then we would be more than happy to help folks navigate the Maryland Health Connection application process.
What are, when they get on a call like you with a navigator, what are some good questions that they should be asking, like right away? They might not even know what to ask. What are some key questions they should be asking you?
Sure. A good question could just be like, hey, before I start, can you walk me through the process? Can you tell me what I might need? So what kind of documents you need to provide? If you need to provide any documents, you might have all the information you need already. If they're unfamiliar with any terms, or if it's their first time applying, if we can break down terms like deductibles, co-insurance, co-pays, things like that, what your monthly premium might be. Also asking, what is the financial assistance? So how does the financial assistance work with the plans? So questions like that. And then more in depth, what kind of medications do folks take? So, we can see if their medication is covered, at what copay with the plans.
Okay. And I want to remind you, as you are tuning in with Maryland Health Connection, myself and Steven, you can ask tons of questions. We're going to pop it up on the screen to get an answer, because I'm pretty sure you still have questions. Even years being into, getting open enrollment and doing it every single year, I still have questions all the time. I'm like, okay, well, wait a minute. Should I do this, or should I take away this, or how much does this cost? Is dental this price, or, whatever to kind of go with. So ask all the questions you want. Let's talk about the plans that are available, because that's a big one right there, right?
Big one, yeah. So Maryland Health Connection offers health plans from insurance companies that you already know. So like Care First, Kaiser Permanente, United Healthcare. And you can also enroll, like you said, in Medicaid. So you can get what's called a managed care organization. So that's something like Priority Partners, Amerigroup, United Healthcare, things like that. So as far as dental, there are plans from Delta Dental, Dominion National, Care First, just to name a few. So actually between the three health insurance carriers that are offered, they have up to 32 plans between all three. So many options to choose from.
And see, that's what makes it so difficult. I feel like there's so many different options, which is great, because I love good options, right? But then you're kind of like, which options do you get? It's like going to Cheesecake Factory. You got all these different things, and they're all great, but you don't know what to choose. And so that's why it's great. Can you mention that event again, that they can attend that in Pikesville?
Sure. So the event in Pikesville is December 10th from 9 a.m. to 1 p.m. And that's at the DoubleTree in Pikesville. So that's off Reisterstown Road. So that's 1726 Reisterstown Road. December 10th, 9 a.m. to 1 p.m.
Okay, good. Because I think it's important for you all to attend that too if you have questions outside of this event that we're having right here with Maryland Health Connection. Let's talk about coverage and what exactly is covered between doctor visits and medications and things like that.
Yeah, so the health plans are, a full health plan, comprehensive coverage. And they include things like important health benefits such as doctor visits, prescriptions, mental health services, and more. And things like preventative care are totally free to folks. That includes vaccinations, cancer screenings, and an annual wellness visit with healthcare providers.
Okay. And, when you're talking about like mental health, of course, since the pandemic, I feel like a lot more people have been more in tune with their mental health. Have you seen a big jump when it comes to that in coverage?
Yeah, I've seen a lot of people like asking about mental health coverage. They want to know what copays, what it might cost, if if there's a deductible, stuff like that. If they need to see a therapist or a psychiatrist, anything like that. A lot of people have been asking a lot of questions about mental health services. And all plans have some coverage for mental health services.
Okay, good. So there's a little bit of something in there for if anybody wants to get mental health.
Exactly. Yes.
Good. So when you were talking about money and being affordable, or people asking what different plans and what different prices, I'm sure a lot of different money and numbers go around. Are health plans affordable? Because a lot of people might think they just can't afford it.
Very true. So you can get free or low cost health insurance through Maryland Health Connection by using tax credits. And it's the only place you can get financial assistance to lower your monthly premium. Actually, in 2022, the average Maryland Health Connection customer buying private health insurance saved an average of $300 a month on their monthly premium. And actually, many Marylanders ages 18 to 24 can get special discounts for 18 to 34, special discounts for 2023 health plans on top of the savings that they can get for the monthly premium.
What are some of those special discounts?
Yeah, so actually the Maryland State Legislature approved like an extra state subsidy for folks in that age range.
Okay.
So it could be like another, like $50 or $100 on top of the financial assistance, so that younger folks get enrolled. So, more people are participating in the healthcare system, which can bring down the premiums for everyone.
This is good. So all my college folks right now, if you're listening and you are watching to us, make sure you get and be a part of this, because you can save some money. So I know in college you're not making that much money, so we're gonna make sure we make it work the way we best can. Okay. What exactly is needed when you enroll?
Yeah, so for everyone applying for a health plan, you'll need a photo ID, like if you're doing it in person, social security number, so you can just have that ready, and immigration or citizenship documents for some folks, and then things for income like a pay stub or a W-2 or a wage statement if you're employed, and then policy numbers from your current health insurance if you have a current health insurance policy. So just a few basic things to get started.
Yeah. Can you also talk about, like, how do you know which plan you should be going with? If somebody, like if your spouse has, you feel like a better benefits than you have, like what are some things you should be looking forward to? Because maybe my husband has better benefits than I do. Like what would that be?
Right. So let's see. So you can look at if the plan has a deductible and what the deductible might be like for, a plan that you already have versus a new plan through Maryland Health Connection. You can look at what's called your out-of-pocket maximum. So that's the maximum you would be expected to pay out of pocket for costs during the policy year. So if you have a low out-of-pocket cost, that means that you will be paying less for your health care overall. You can also look at things like co-insurance. So we all are pretty familiar with a copay, which you pay for services. Co-insurance is when you pay a percentage instead of a fixed amount.
Okay.
And then also the coverage network. So, if you have a limited coverage network, or if you want to be able to go to providers outside of your network, it's good to take a look at and see what your providers accept, or any new providers that you might want to go to.
See, co-insurance, that's new to me, honestly, because I've never actually heard of co-insurance. Sorry. So that's something really good that people can be utilized as well.
Right, exactly. And it's a good way to know, some folks with co-insurance, they're fine with it. Some people would rather just pay a copay so they know what they pay every time.
Mm-hmm.
If they're going to the doctors frequently. If you're not going so frequently, then co-insurance might be a better option, depending on what the plans have.
Mm-hmm. Some people also might say they don't even know what they should have or what's important to have when it comes to their health, because maybe they just felt like they're super healthy. What are some good plans that you feel like is important to have, just because you always have to expect the unexpected? You never know what's going to happen, right?
Right. For emergency room visits, it's always good to have a low deductible.
Mm-hmm.
So any plan that's going to have a low deductible, so that if you go to the emergency room, you're not going to pay, like $6,000 out of pocket.
Right.
So a low deductible is good. Having like a small copay for an emergency room visit is good as well. So even if you have no deductible, if you have a small copay, like $250 for an emergency room visit, that's good. And then also having low copays for prescriptions, if you take prescriptions, that's good. Um, and let's see what else.
Because we want all the options, Stephen.
Right.
Okay, we want everything.
Yeah, and you'll find there are a lot of plans at a lot of different price points. So if you feel like, a plan is too high in the monthly premium, you can get a plan that maybe you have a slightly higher out-of-pocket cost. Because what's the point of having a good health plan if you can't afford it?
Yeah.
So you definitely want to make sure you get one that is affordable to you, and that looks different for everybody. And just try to minimize costs as much as you can.
Yeah, and I agree. And also, I think sometimes people just utilize the health plans that their jobs have, and then they say, okay, this is what they provide for me. I'm just going to go with that. Isn't it very important to also shop around and figure out what makes sense for you?
Yeah, that's very true. So, for example, some plans through your employer, maybe they don't cover your spouse. So you end up paying a lot for yourself and your spouse.
Yeah.
So you can also shop through Maryland Health Connection if you would like specifically for your spouse, and you might get savings that way to bring your total, monthly health care costs down. It's also always good to just, like you said, see what's out there. So, are you paying, a good like conventional amount for your health insurance, or is the insurance through your job really unaffordable? Because even if you have insurance through your job, you can potentially still get financial assistance for your plan through Maryland Health Connection, just depending on what your income and household size might look like.
And
So it's always important to shop around.
Yeah, is that something they can find out on the website if they can get extra assistance?
Yeah, so they can use the Get an Estimate tool is really good as far as, you don't have to put in too much information for the Get an Estimate tool. So you can just put like your age, your zip code, and what you estimate your annual income would be. And it can give you all the plan options that are available. And it'll give you an estimate for the financial assistance as well.
Okay. Perfect. So as you are watching right now, this is Stephen with Healthcare Access Maryland, representing Maryland Health Connection. I'm Persia Nicole, and open enrollment is here. We're trying to make sure you are prepared for the top of the year. And like Stephen was saying earlier, if you missed it, make sure you kind of get it in December the 31st if you want to have it by the 1st at the top of the year. Because if not, come January, if you wait, you won't get coverage until February, correct?
That's exactly true. Yep.
Yeah, I want to also bring it back because we have a little bit less than 15 minutes left, but people might have joined midway through. I want to take it back to some questions just in case it may have missed it. Let's talk about exactly what Maryland Health Connection is and how that works. Let's bring it back to that.
Yeah, so Maryland Health Connection is the state insurance marketplace, and it's the only place where you can get financial assistance for your monthly premiums. So to bring your monthly payment down for your plans. And you can also get some extra state subsidy assistance. So on top of the monthly financial assistance that has been available for years, you can also get some state assistance. Through Maryland Health Connection, you can also browse plans if you just want to get an estimate. And you can also find some educational things, like if you want like a hard copy to tell you what a copay and deductible might be, just to have on hand for your reference. You can also use a new feature called Broker Connect. Broker Connect allows you to talk to an authorized insurance broker in about 30 minutes or less. And a broker will call you to discuss any private health plan options. And it's all free.
And that's what we like to hear. Okay. And as a navigator, Stephen, let's also bring it back to the question as to what they should be asking you when they call if they have any questions about enrollment.
So any questions about open enrollment, folks should be asking, what a deductible is, what deductible, if it applies to the plan that they're interested in. They should be asking about their out-of-pocket healthcare costs. So how much they are expected to pay out of pocket for things like doctor visits, specialist visits, emergency room visits. Folks should also be asking about their prescriptions. So we can check and see if their prescriptions are covered at like generic or brand name. Folks can also ask us about what doctors are in network. So if their doctor is in network with maybe a new plan that they want to transition to. And they can also ask us if they would like to schedule assistance, in person, like at enrollment events. And folks can also go to their local health department too if they have questions.
And if we maybe don't want to actually call, pick up the phone, can we do this on the app as well? Can we talk to somebody live?
So on the app, you can do it on the app. There is a assistant called Flora, like a virtual sort of chat feature through Maryland Health Connection website, and you can get assistance that way as well.
Okay, so make sure you get up in there and hit up Flora. I feel like that's a cute, like little name too. Hey, Flora girl.
Right.
Also, I think it's really important that people understand that insurance and all of this is very, very important. I think we've seen it, especially when it came from the pandemic and people weren't insured, or they were like, oh my God, I have to get the COVID shot, or I have to get this, or I'm sick, or I have to bring my baby to the doctor, and not having insurance played a huge part in people falling short and not knowing what to do. So this is the time to make sure that you are absolutely insured, right?
Absolutely true. You want to make sure you're prepared for unexpected things like an emergency room visit, or maybe you catch a cold or a flu really bad and you just need to go get checked out by a doctor.
Yeah, and they're talking about I don't know what it's not even the twin-demic anymore. It's something else they said we're gonna get, and I'm like, whatever it is, honey. I don't want no parts. I'm gonna make sure I'm good, right?
That's exactly true. I want to make sure you're prepared for those things that are unexpected, and then as well as those everyday things that you plan for.
Let's bring it back to the enrollment, how people can enroll.
So folks can enroll by visiting marylandhealthconnection.gov. So they can do it all online. They can also call Maryland Health Connection directly at the state call center, where assistance is available in more than 200 languages, nice. And for the deaf and hard of hearing as well. Folks can also call Healthcare Access Maryland. That phone number is 410-500-4710, where they can get connected to a navigator like myself. And we can help folks over the phone. We can also do like a video appointment and share our screen if they want to look with us and see what options are available. And then they can also call us to see what in-person sites may be open. So we are still offering in-person assistance. And we also have our enrollment event on December 10th at the Doubletree in Pikesville off Reisterstown Road. And that's December 10th, 9 a.m. to 1 p.m.
Yeah, and I think that event's going to be really important. And I'm happy you mentioned that again, because you'll get access to everything you need right in front of you, instead of the sharing the screen, like really being able to ask all the questions you want and get it all out, That's
exactly true. And you'll also, any questions that come up, because they, do inevitably, as you're browsing the plans, there's no delay. You can just sit there naturally like you would and just speak to someone and get it all sorted out.
Yeah, and I'm happy you talked about the plans. Let's mention that exactly what plans are available with Maryland Health Connection.
So there are plans from Kaiser Permanente, United Healthcare, and Care First. So those are all private insurance plans. Many work throughout the state of Maryland and the DC, Maryland, Virginia area, depending on the plan. You can get an estimate through Maryland Health Connection. And there are up to 32 plan options between the three carriers.
So it's a ton of different options right there, whatever fits you and your home life and your family. Make sure you get a part of that and really get insured and get coverage for the super unexpected, because we have seen so much unexpected things happen throughout the last few years. So definitely be a part of this. As you are watching right now, wherever you're watching at, you can ask last minute questions. We have a little bit over 5 minutes left, so I want to make sure you get everything answered. And as you're thinking about your questions, Stephen, we're bringing it back to things you may have missed in the beginning of this live event. Let's talk about the coverage. What is covered?
So important health benefits are covered, such as doctor visits, prescriptions, mental health services, and more. Additionally, some services are totally free to folks, such as any preventative care, including vaccines, cancer screenings, and even an annual wellness visit.
Okay, and the big part right here is about the money. Everybody always wants to know, how much is this? Can I even afford it? Is anything free? So let's talk about that as well.
So in Maryland, the average customer through Maryland Health Connection buying a private health plan saved an average of $300 per month from their monthly premium. And many Marylanders aged 18 to 34 can get special discounts on top of the monthly financial assistance for their 2023 health plans through Maryland Health Connection. And the financial assistance, it's a tax credit, so it's applied every month to your monthly premium. And at the end of the year, you just get a little form that just documents that you received the financial assistance, and you just include it with your taxes.
That's important right there. We are saving money as college students. We're saving money as adults. And I think this something like this is important for us to have this conversation because, myself, when I grew up and get into college, I wasn't taught these are the things that needs to be done. And even in college, they don't really teach you these things as well. And in high school, I think we need to have more platforms to do that. So it's important that you're here, Stephen, to give us the good information we need about open enrollment and what our next steps should be, So I appreciate you.
Oh, thank you.
You appreciate it. Yes. Okay, before I let you go, we just got a few minutes. I want to talk about really quick, remind them how they can enroll, where they can enroll at, phone numbers, or just some good tips that you can give everybody as they're tuning in.
Yeah, so folks can enroll by going to marylandhealthconnection.gov. And to find assistance, they can also go to marylandhealthconnection.gov/help. They can be connected to local brokers in the area with a feature called Broker Connect. So you can talk to an authorized insurance broker in about 30 minutes or less, and the broker will call you and discuss any private health plan options, and it's all free. You can also download the Maryland Health Connection app called MHC Enroll and enroll right on your phone. You can also use the chat, the assistant feature through marylandhealthconnection.gov called Flora to assist with a few basic things, like even like a password reset, and also to finding in-person assistance locally. And you can also call Healthcare Access Maryland and work with a navigator like myself. The phone number is 410-500 4710. And then you can also schedule an appointment with a navigator like myself and do a video chat if you prefer that. So if you want us to share the screen and we can look at the details of each plan side by side, or we can also do it all over the phone if you just would like us, to sit back and kind of let us take it from there.
Yes, absolutely. And if they don't feel like they want to do all those different things, they want to see you in person, let's talk about that event that is on the way in December again.
Yep. So the event is at the DoubleTree in Pikesville, and that is on December 10th. It's a Saturday from 9 a.m. to 1 p.m. And again, it's a DoubleTree in Pikesville, 1726 Reisterstown Road.
And they can sign up there, right?
Yep. So you can bring whatever information you have. Even if you don't have all your documents together, we can still get something done. And then if documents, are required, you can provide those later. But you can work with a navigator like myself. There will be many navigators there, and we can enroll you on the spot. And you can have like a natural conversation and just get it all done in person.
When it comes to open enrollment, though, on the spot, do they need to have banking information, like when it comes to financial?
So they can have things like income documents, like pay stubs, like 2 pay stubs would be great. Or you can have your W-2 or your taxes, whatever is most convenient. You want to have your social security number or numbers if you're enrolling, your family as well. A photo ID, just to verify your identity. And if you are not a U.S. citizen, you want to have something like your immigration documentation, like your permanent resident card or something like that.
Okay, perfect. Stephen, thank you so much. Before I let you go, give me the website really quick they can go to one more time.
The website is marylandhealthconnection.gov.
All right. It's also at the bottom of the screen right there, too. So hopefully you've seen that the whole time as well. Stephen from Healthcare Access Maryland, representing Maryland Health Connection, is, of course, with us. If you miss any of this information, we're going to keep it live so you can always go back and kind of skim through what you want to find out for information. But Stephen, I thank you so much. We appreciate you. Hopefully you link up with him as a navigator. And, it's open enrollment. So make sure you get up in there. Thank you so much, Stephen.
Great. Thank you so much for having me.
All right. Have a good night.
Good night.